That's Nisha behind the mirror right now, and we're doing a little bit of a different kind of timeline. Welcome to the Nisha Jackson Show, by the way. And normally I get to be the guy in the hot seat. You've seen me get my pellets on my butt. You've seen the PRP in my head.
Yes, we did.
And this time it's Nisha, and Nisha is, what are you doing?
I'm going to have some Botox today. I'm going to take care of a few little fine wrinkles. I've been getting Botox for many years now.
That sounds very scary.
I like to keep updated on my
Botox, isn't that like poison that you put in your face?
Yeah, but it's the actual toxin that you should keep in your life and get rid of all the other ones. Oh. It's the one toxin you need in your life.
I'm totally using that.
All right, so I'm going to get out of the way. We're going to let the professional, Dr. Rachel here, do the work, and I'll be laughing behind the camera, and then we'll do a wrap-up in just a minute.
So guess what? I'm in the hot seat now. This is Dr. Rachel, and she is our aesthetics director at OnePeak Medical. And I get to have Botox right now, and she's going to explain to you how she administers Botox and all of the little details about it. And then also fillers, because she goes around to all of the OnePeak medical offices and provides these services. And we chose Dr. Rachel to do this because she has years of experience. She's been in private practice and is very comfortable and very careful with her patients. So take it away, Dr. Rachel.
Okay, I love it when you're in the hot seat, by the way. Just salivate a little bit.
Yeah, exactly.
So a little bit about Botox. And nice about Botox, it's very well tried and true. So it actually has been on the market, FDA approved for cosmetic uses since 2002. So this is not a new thing. A lot of people have had it done, and we keep expanding the areas. So it started being used for the frown lines, and then now it's gotten approval for crow's feet and frontalis lines. And then we do it in a lot of other places too. But I want to show you, this is how I explain to patients how Botox works, because it's simpler to explain with a piece of paper. So if you take a piece of paper and you fold it, and you fold it, and you keep folding it, what's going to happen? You're going to get a crease. So unless you stop folding that piece of paper, the crease is going to get ever and ever deeper. So the way Botox works is it decreases the veracity of your muscle contraction. So you can't fold that piece of paper as vigorously. So if you stop folding a piece of paper, if you lay that on a counter someplace, you're going to come back in a month and the crease is going to be softer. So that's the goal, is to treat dynamic lines with Botox. So if you start early, you know, the most awesome patient for Botox is early 30s, believe it or not. They don't have any lines yet. You start doing Botox, they don't get a line. So if you come in and you have a very deep crease, I can make it better with Botox, just it's going to take me a little bit longer. So with Nisha, I mean, she's pretty much perfect, but let me point out a few things. So, you know, we can actually do a little Botox to soften these glabellar lines, you know, because if you keep folding and keep folding, they're going to get deeper. You can also do a little Botox in this muscle, the periocular muscle, to give you a little bit of a lateral raise. You can imagine if you contract that muscle, it goes in and down. If you put a little here, it gives you a little lateral raise. We also can use it a little across the frontalis, although hers looks pretty good right now. So for today, I thought we'd just do a little touch up in her glabellar lines and give her a little bit of a lateral lift. The other thing that I'll talk to patients about, and I use lots of teaching tools when patients come in because it explains things better. So when we're talking filler, I do them conjointly with Botox a lot because it does different stuff. So if you look at the youthful face, this is my favorite teaching tool.
That is a good one.
Youthful face, lots of fat, full up top, narrow below. Old face, nothing up top, you start losing volume. And so this is a really good teaching tool. So filler doesn't have any effect on muscle activity, it just fills. That's all it does. So we're filling in a hole. So you're trying to replace the volume that you've lost. So we lose about 1/3 of our lip volume by the mid-40s, which is a real bummer. You're losing all the support up here. So I use a lot of filler on cheekbone. It's one of my favorites. It's called Voluma. I use filler in the nasolabial folds. I can use filler a little bit in marionettes, although she doesn't really have any. And we also try to augment the lips. And not to give you lips you never had before. That is not the goal. It's to replace volume that you've lost. So if you go out of here looking like Angelina, then it's not me. So it's not my job. So,
really?
No, sorry, girlfriend, you don't get that. So we'll start with what we do with Botox, and a lot of patients are like, oh gosh, does it hurt? It's a needle. It's a little tiny needle, guys. We use ice to numb it before. It's a 5-minute treatment. So once I've done my assessment, I'm going to make some dots on her, figure out how much we need. We're going to draw it up. The injection itself really is 5 or 10 minutes. Well, how about filler? Well, filler's a little bigger needle. So what we like to do before filler is I have patients come in a little early. We put on some numbing cream. And also in the gel, there's lidocaine. So it's made a huge difference in comfort. So as far as filler, I have lots of different fillers that I choose from. We have thick ones, we have thin ones, we have in-between ones. So which one are we going to use? It depends on what we're going to treat. So I use some really thick ones on cheekbones. I use middle for nasolabial folds. And I have some thin ones I use in the lip. So we just choose depending on what we're going to treat. So we're going to start by cleaning off just the areas we're going to treat with a little bit of alcohol. And let's just do a little bit of a lift and a little bit of a lift. So then I always like to dot where I'm going to inject. I swear it comes off. It's Sharpie, don't panic. So make me that angry face. So we're just going to do a little bit here. And then raise your eyebrows really high. So we want to get a little more height out of those suckers.
Let's don't get too close there, Rusty.
So, he's getting awfully close.
Let's don't do the Zoom quite yet.
So then we're just going to make a note of where we're doing the injections. And there always should be, if you have Botox, some kind of a record of where you've injected and how many units, because some people do pull asymmetrically. So if she came back the next time and said, man, this side was still really pulling, we'll know we have to make an adjustment. So I'm just going to make a note about how many units I'm going to put in. And then we have a total. So we're only going to use, let's see, about 7.5 units, just a little touch up this time. So I'm just going to draw that up. So I always put my patients to work, no rest for the weary. So what we're going to start with is you just icing between your eyebrows. So icing for me does two things. It helps with a little poke of the needle, which is minimal, but it also makes your blood vessels constrict a little bit, so you're a little less likely to bruise. And who wants to get a bruise? So whenever that gets obnoxious, then I am ready. So it's a little tiny poke. This medial is very superficial. Just do a little bit here. We're going to do a little bit here. And then one more here. And we are done with this area. So that's all there is for that. And then I'm going to have her ice right in that eyebrow for me. Right there.
Didn't even feel it.
And it is the tiniest needle made, so it's really minuscule. And honestly, Botox is a 5-minute appointment. So after we've done our assessment, we know how many units we treated. We take some god-awful pictures that no one sees but me. But we know what you need for muscle. You come in, you initial the consent, we inject, you leave. So it becomes a very, very quick visit after the first time. Okay, and we're going to have you ice the other side now. Doing a fabulous job.
Thank you. I know, I think most people that are worried about the pain, it's just the fear of having needles in your face. I mean, they're envisioning like how scary that would be, but it really, once you've had it, it's not scary at all. And it's not, I mean, it's a tiny little stick. So,
I think like most anything, if it's new,
it's like plucking
it's scary.
eyebrows. It's like pulling hair out of your eyebrows. It's like, it's not painful.
And one thing that is kind of an aside, but it's kind of comical, this middle portion is actually known as the sneeze center. So I have a fair amount of patients who, when you hit that little sneeze center, they immediately start sneezing. So I kind of know that about them. I have their heads stabilized. And das ist alles. So I'm going to have you take a real hold and pressure there for just one more minute. We're going to get her little dots off of her because she looks ridiculous. And then we are going to be done.
There it goes.
Here.
So what does it feel like right now to you, Nisha?
Doesn't feel any different at all. I mean, some people, the first time they have it, they'll say, wow, it feels so weird. I don't feel like I can move my muscles. Well, that's kind of the whole idea. It usually takes longer than that. Rachel can talk about that, the full effect of the Botox treatment and how long you really get full effect. And some things that can go wrong, but for the most part, it doesn't really feel any different at all. Post Botox, it's important to do a few things that Rachel will talk about also.
Well, one thing I do get that, especially for timers, are like, I can't move already. Well, it doesn't work that fast, hate to tell you, but a lot of times just that little bit of volume you put in it makes it feel like something's happening, but it doesn't do squat for the first 3 to 4 days. About day 3 to 4, when she really tries to frown, she's going to notice she can't pull quite as hard, but the maximum effect is in 2 weeks. So in 2 weeks, I don't want her to have a lot of activity there, and that's the goal. And then how long does it last? Well, when you first start doing Botox...
And when you say a lot of activity there, explain what that means.
So I don't want her able to really furrow her brow. I want some movement, because if you've seen people on TV, they're smiling and there's no activity up there, it looks frankly weird. So I want some movement, but if she can still accordion up that skin, she's still making that crease worse. We're not doing our job. So especially new clients, if I'm getting used to their muscle mass, I'll say, look, in 2 weeks, if you can still really move that muscle vigorously, you might need a little bit more Botox. And then it lasts for about 3 months when you start. So we arbitrarily will make her an appointment to come back in 3 months. But if she keeps up with it, what happens, I'm going to put a little arnica gel on there, which helps with the bruising risk. So if you keep up with it, your muscles atrophy. It's kind of like when you're lifting weights. If you stop lifting weights, your muscles get smaller. So that Botox will start to last just a little bit longer. So we'll know when she comes in for an appointment, I'll say frown, there's no activity at all. We'll know next time we can go a little bit longer. And what I'm putting on now is just a habit of mine. I like to always put on a little bit of arnica gel after injections. It reduces a little bit the risk for her getting a bruise.
So making the facial expressions afterwards helps?
Every time you leave, you will go home with a little aftercare sheet every single time. So the most important thing is for the first hour, you're going to make faces at people. So you're going to frown, you're going to raise your eyebrows. They're going to think you're a little bit odd. So just for an hour, you keep doing that, about every 5 minutes. After the first hour, stop doing that, because now you're just making your creases worse. The main thing beyond that is do not massage the area, because I don't want somebody rubbing it into an adjacent muscle and coming back to me with some weird droop. So you are going to do activity, but you aren't going to massage it. You can wash your face afterwards. I just don't want you massaging it. So that's the big thing with Botox. Filler's a little different. When we do filler, there's a little more complex aftercare instructions because we have a gel now involved, and we do not want an infection getting in the gel, so you can't put any makeup on for a 24-hour period. You have to be really cautious not to get bacteria in the hole, so it's a little more intense as far as aftercare, but beyond that, Botox is pretty simple. So make an angry face and don't massage it.
All right.
Piece of cake.
Sounds good. Thanks, Rachel.
You're welcome.
2 weeks, I'll show you my face.
Yeah,
I won't,
2 weeks.
I won't have that angry look. Thank you.
Thank you.
I would have cried, and you're like laughing.
No, it's super easy.
Really?
You should have it done. We can take care of these wrinkles, maybe pop up those eyebrows a little bit.
Listen, I look good for a 70-year-old guy.
Fillers here to bring up those cheeks. There's lots we can do.
Okay, now
Brad Pitt.
I have an hour.
Making.
I have another hour, so.
You need one. Yeah, I mean, does it last long? I mean, you have to, once you do it, you have to keep doing it?
Well, you want to because you look so great that you want to keep doing it.
Okay.
But why wouldn't you?
Right.
I mean, if you have the option to age better and have your face look better as you age, why would you not take that option? If you have the option to do that, I mean, I think it's a wonderful thing.
Okay. If you want to find out how to do it, go to
It's
Nisha.
preventative too. It's preventative.
All right.
Right?
Exactly.
It's younger, get better.
And if you go to, I was going to say, go to nishajackson.com to find out more. If they want to have Dr. Rachel help them, can they go through nishajackson.com?
Absolutely. You can go, or you can go to right to our website, OnePeakMedical.com. And Dr. Rachel, you can book an appointment and come see her.
Fly out from all over the world.
She's
People
the
do
best.
come see her. She's the best. All right. We sure appreciate you. Don't forget to subscribe. Hit that subscribe button, the like, the share. We sure appreciate you. Until next time, I'm Rusty Ivory. She's Nisha Jackson, and this is The Nisha Jackson Show.